Hello. Thank you for joining me. So we dentists hear this from our patients all the time, that can't you just do a filling instead of a crown? My previous dentist did that for me and it lasted for so many years. So that's something I wanted to talk about today. And then there are all these different terms for porcelain restorations. Crowns are called caps, and then there is inlays and onlays, and there are fillings and veneers and so many different things, so that can get confusing. So I wanted to bring some clarity to you and wanted to talk about why can't we do a filling instead of a crown. If we have not met before, my name is Dr. Mansi Oza. I'm a cosmetic and a general dentist, the owner and the founder of Thurmontsmiles. And I think I started placing dental crowns in my patient's mouth back in 1994 when I was attending my first dental university back in India. That was the third year of my dental school. And I'll tell you, I have had a crown in my own mouth because my tooth had fractured. So I've been on the other side also. So I would love to hear from you. I can see there's someone watching. I can't tell who because it's not appearing on my screen, so my apologies. But if you have had crowns from us before, I would love to hear from you in the comment section. Let us know how your experience was and how you are functioning with your new crowns. So do write in the comments. So I'm going to talk about what a dental crown is. So some people also call it a cap, which is also a very commonly used term. So basically a dental crown is something that wraps around the entire tooth. Basically, when I explain it to you, our patients, I say that it is a helmet for the tooth. So whenever a tooth structure is completely damaged or partially damaged, then it needs some structural support, and that's when we put the crown on. And there are lots of different materials, but nowadays most patients prefer porcelain because it looks like a tooth and it is high in strength. So that is when we do the crown. So what are some reasons where the crown is needed? So the first and most commonly seen reason to put a crown on is when tooth is root canaled, especially the back teeth, not so much in front. I try to avoid that, but in the back teeth we put the crown on whenever tooth is root canaled. So basically I have a model here. So you can see here a cavity starts here, and then when the root is infected, we need to remove all that infection all through that root, and most of the middle structure of the tooth is hollowed out. And you can understand that now the outside shell of the enamel, if it remains, it would easily break under pressure, the biting pressure, and that is when we surround the tooth with a porcelain crown. Also, whenever the root gets infected, you lose the nourishment to the tooth which comes from the root. So the tooth basically gets dry, it loses its ability to remineralize on its own. So it needs that structural support with a crown. Second most common reason, I would say, that is trauma. So trauma happens with a blow to the face. That is one of the reasons why we put a crown on the front teeth if the tooth is like almost fractured in half. And similarly in the back teeth, if someone is clenching or grinding and if they are losing all that enamel, and if the tooth fractures, that's when again the structure is damaged, and we put a crown on the tooth to prevent further damage. And the third reason is large big fillings or large decay. So if you are a patient, you know that we remove the mercury fillings safely from your mouth. And very often I see that the mercury fillings are already very large. They have already replaced part of the major tooth structure. Plus, I would say 100% of times I find cavities underneath it. So the total area that remains is really tiny, and the tooth is at risk of fracturing if we try to do just a filling. So whenever we remove large fillings, it could be a white filling also, or the tooth has already had a big decay, big cavity, we need to support the structure with a crown. So what is the difference between a crown and a filling? So a crown is basically, it's a porcelain or metal restoration. In our practice we do porcelain, but sometimes we do gold. Whereas a filling is a filling material, so it relies a lot on the tooth enamel or the remaining tooth structure. So if you see here, let's look at the top part and imagine that the person only had a cavity in the center part of the tooth, but the rest of the tooth structure was healthy. So obviously this tooth structure stays healthy, it can hold the filling in the center of the tooth. But if this was a large cavity, then you can see here the tooth structure is already undermined, and if you try to put pressure on this part or this part, because it is undermined, this part is going to just crack off. So in that case, the filling material just cannot hold and it will crack off. I will say though that I've helped a lot of patients who could not afford dental treatment, and if they needed like 2, 3, 4, 5 or more crowns, that can get really expensive. And if we wait for them to get the dental treatment for 5 to 10 years, then they probably will not have any teeth at all. So in those cases, I have removed the cavities and I have placed really large fillings in those teeth. But you know, I've been practicing dentistry for 20 years now, and I see that if those patients don't return back, or if they don't get the crowns in reasonable amount of time, the tooth definitely does fracture. Sometimes it lasts a long time, sometimes it doesn't. It depends on what you're eating, or whether you're clenching or grinding, or how large of a tooth structure is missing, but definitely the tooth breaks if it's already a very large restoration. So I hope this really clarified. I would like to hear from you if you are listening to me live, or you can feel free to comment below if you are listening later after this live ends, and I'll be sure to answer your questions. So it doesn't look like I have any comments right now. So yeah, so there are a few concerns, common concerns about the crown. So the first one is that how is it going to look? So like I said, there are different materials. There is porcelain, then there is metal, there is porcelain fused to metal, different hey Chuck, and thank you for joining. So there are different materials for the crowns, and if you are concerned about the look, we can definitely match that to your tooth structure and make it in porcelain, which is very high strength, and it matches your tooth or your natural teeth completely. So do not worry about how it would look. Second concern is the time that it takes. So most people cannot go to the dentist twice and spend hours just for that one crown. And if you are a patient, you know that we use cutting edge technology, and in most cases we are able to do the crowns in just one single visit. So you don't have to get numb twice, you don't need any impressions. We scan the tooth, and I don't have to relay the information to anyone else. I design the crowns myself, so I take pride in that, and I'm responsible for the materials and the quality of the restoration that's going in your mouth. So that is something we do at our practice. And there is also concern about how many crowns will be needed, or how much is it going to cost. And I will say that if it's really obvious to the insurance company, if you have dental insurance and there is a root canal or big cavity with big decay, they tend to cover it quite a bit. We also offer our in-office discount plan for those who do not have dental insurance. So we try to make it much easier for you you. And we do have affordable financial options also, so we can check and bring the cost down quite a bit for your monthly cost. And I would end this live by saying that my approach to treatment is very, very conservative, meaning that I would not open up a tooth if it's not really, the treatment is not really needed. The smaller is always better because the tooth structure cannot grow back. So my effort is always to do the smallest possible restoration for you. That is obviously more affordable for you, but it's really good for you in long term. So for people who grind their teeth and who have lost a lot of tooth structure, we have developed a hybrid program for them. I use different materials to bring the cost down, and I end up not removing as much tooth structure as would be needed by traditional methods. We are also able to do smaller crowns that are called inlays or onlays. So we are able to preserve a lot of tooth structure compared to traditional crowns because we have the technology available, and I don't have to worry about the temporaries coming off and things like that. So I would say that I always 100% of times try to make sure that I don't remove unnecessary tooth structure and do only the best treatment that is necessary for our patients. So feel free to write in the comments if you have any questions at all. We'll be back in the office tomorrow, so if you need to ask any questions, our team members are always ready, and the number is 301-271-4400. So thank you for listening. I'll see you next time, and keep smiling.